Hello, this is Dr. Scott. I wanted to talk to you a little bit about vaccines for your puppy, booster shots, as we call it. Everybody knows that when you get a puppy, just like children, they need to go through a series of vaccinations to protect them against a variety of different infectious diseases. I just wanted to kind of outline those vaccines for you so you understand what we're going to do for your puppy. Basically, there's two types of vaccines that we give. One group of vaccines we call our core vaccines. Those are vaccines that we give to every dog regardless of their situation. And then the other vaccines we give are vaccines that we give depending or not whether your dog needs them based on their lifestyle or anticipated lifestyle. I'm going to start with core vaccines. What we're going to do for your puppy is give a distemper hepatitis parvo combination vaccine that we start usually at around 6 to 8 weeks of age, and we continue with that, giving it a booster every 2 to 4 weeks until your puppy is about 16 weeks of age, at which point we give the last booster with the distemper hepatitis parvo combination. The other core vaccine is against a bacteria that's called leptospirosis. Leptospirosis is a bacterial disease spread in the urine of infected mammalian wildlife. The leptospirosis vaccine is a vaccine that's given at around 12 weeks of age, and then we booster that one more time at about 16 weeks of age, and then we booster that once yearly thereafter. The third core vaccine we give is to protect your dog against Bordetella. Bordetella is a very contagious respiratory bacterial infection. It is not typically a life-threatening disease, but the reason we vaccinate for it is because it is very, very contagious. So we've got leptospirosis, distemper hepatitis parvo vaccine, Bordetella, and the last core vaccine that we vaccinate against is most everyone's heard about the rabies vaccine. And that vaccination is given once to your puppy at around 14, 16 weeks of age, and then we booster that on an annual basis thereafter. There's two other vaccinations that we recommend depending on your dog situation. One vaccination is against Lyme disease. We recommend that vaccine to dogs that are going to go out in the fields, out in the woods, to the forest preserves. If you travel or plan to travel with your puppy to Wisconsin, up north, if you plan to travel with your puppy down south in southern Illinois, or if you plan to go with your puppy or dog at some point to the East Coast, the Eastern Atlantic Seaboard area, region is chock full of Lyme disease. We actually have Lyme disease here in the Chicago area. Your dog is at more risk for Lyme disease if we go to areas where there's ticks. Lyme disease is a tick spread disease. So if you plan to go with your dog to these areas that are high risk for ticks and Lyme disease, we recommend that you talk to us about getting your puppy vaccinated against Lyme disease. If we do that for your dog, it's basically a vaccination at about 12 weeks of age, a second booster 2 to 4 weeks later, and then we booster that vaccination once yearly thereafter. The second vaccine that's not necessarily considered a core vaccine is a vaccination against canine influenza. There are two strains of canine influenza. We vaccinate for both of them. We recommend this for dogs that are at a high risk for picking up on canine influenza. Those would be dogs that go to doggy daycare, go to the pet store a lot, dogs that go to dog parks, that go to the groomers frequently, and dogs that are boarded on a regular basis. Anywhere where dogs congregate creates a higher risk that there may be canine influenza. So if your dog goes to areas where lots of dogs congregate, then we recommend the canine influenza vaccine. That is also given at about 12 weeks of age with a second booster at around 16 weeks of age, and then once annually thereafter. So again, we'll review with you likely by phone if you're in the car, about what vaccines your puppy is due for. Please let us know if you should be vaccinating your puppy against Lyme disease and whether we should be vaccinating your puppy against canine influenza. And again, if you have any questions, be sure to ask your doctor when you talk to them on the phone. Thank you.